1. Which of the following best describes an important principle when developing nutrition support education programs for adults? A. Focus on theoretical knowledge rather than practical application. B. Address specific learning needs and prior experiences. C. Avoid feedback from learners during the process. D. Use one-size-fits-all instructional methods. 2. What is the primary purpose of evaluating a nutrition support clinician's understanding during a course? A. To assess the clinical application of nutritional therapy. B. To gather data for course accreditation. C. To check comprehension of regulatory requirements. D. To ensure consistent delivery of nutrients to patients. 3. Which of the following is a key characteristic of adult learners in a nutrition support program? A. Preference for passive learning. B. Desire for content to be immediately applicable to practice. C. Reliance on memorization of facts over practical skills. D. Disinterest in feedback or performance evaluation. 4. What strategy is most effective when mentoring a new nutrition support clinician? A. Providing detailed theoretical lessons before any practical experience. B. Offering continuous feedback and real-time learning opportunities. C. Allowing independent work without supervision. D. Relying on external certification exams to gauge success. 5. Which of the following represents an essential component of a nutrition support clinician's curriculum development? A. Theoretical discussions about historical nutritional trends. B. Emphasis on one general approach to all patient types. C. Integration of evidence-based practices and individualized care. D. Ignoring patient feedback on nutritional therapies. 6. In the context of regulatory compliance, what is the primary responsibility of a nutrition support clinician? A. Ensuring nutritional support is provided based on patient preference only. B. Familiarizing with and adhering to legal, ethical, and institutional guidelines. C. Delivering nutrition interventions regardless of clinical evidence. D. Delegating the responsibility for compliance to others in the care team. 7. What is the most effective way to ensure a clinician is capable of following proper nutrition support protocols? A. Using a test-based approach to measure knowledge of guidelines. B. Providing hands-on training and supervised practice. C. Allowing clinicians to self-assess their competency. D. Focusing on knowledge retention over practical application. 8. Which communication strategy is vital when instructing adult learners in nutrition support? A. Providing complex content without summarizing key points. B. Encouraging open dialogue and real-life case discussions. C. Avoiding interruptions and providing a lecture-based format. D. Relying solely on visual aids to explain nutrition concepts. 9. How can a nutrition support clinician's learning environment be optimized for adult education? A. By limiting real-world case studies and focusing on theoretical knowledge. B. By providing a structured, rigid approach to learning. C. By creating a collaborative and interactive setting. D. By offering minimal learner engagement. 10. What is the most appropriate method of assessing a nutrition support clinician's readiness to independently provide care? A. Observing their ability to recall nutrition facts in a multiple-choice exam. B. Reviewing their work with patients in a supervised clinical setting. C. Asking them to complete a written exam on dietary protocols. D. Relying on self-reported assessments of their skills. 11. Which of the following is essential when communicating with patients about nutrition support therapies? A. Using technical medical jargon that may confuse the patient. B. Simplifying explanations and focusing on patient concerns and preferences. C. Relying exclusively on written materials for communication. D. limiting patient input to maintain control over the therapy process. 12. In the adult learning model, what is the role of feedback in a nutrition support program? A. It serves as a formal evaluation tool for grading. It helps refine techniques, encourages growth, and enhances understanding. C. It is used solely for assessing compliance with guidelines. D. It has no significant role in the learning process. 13. When developing a curriculum for nutrition support clinicians, which of the following should be emphasized? A. Detailed knowledge of historical theories in nutrition science. B. Immediate applicability of skills in real-world clinical settings. C. Theoretical exercises with minimal practical application. D. Uniformity in educational delivery to all learners. 14. How can the learning needs of a diverse group of nutrition support clinicians be best addressed? A. By using a universal approach for all learners. B. By offering individualized training plans based on their skill levels. C. By focusing only on the most experienced clinicians. D. By ignoring previous experience and providing basic-level content. 15. Which of the following is critical for fostering a successful mentoring relationship with new clinicians? A. Providing minimal interaction to promote independence. E. Consistently offering constructive criticism and guidance. C. Allowing the mentee to operate without oversight. D. Keeping the mentee's learning experience strictly theoretical. 16. Which of the following reflects a key principle of regulatory compliance in nutrition support? A. Ensuring clinical practice is flexible and based on personal judgment. B. Adhering strictly to current guidelines and regulations governing patient care. C. Limiting patient education to basic nutritional facts only. D. Delegating all regulatory decisions to other healthcare professionals. 17. What is the most effective method of promoting evidence-based practice in a nutrition support curriculum? A. Relying on outdated guidelines for patient treatment. B. Incorporating case studies based on current, high-quality research. C. Encouraging learners to use personal experience over research evidence. D. Focusing solely on textbook information without practical application. 18. In a mentoring program, which of the following is a best practice? A. Giving all mentees the same learning tasks without variation. E. Offering guidance tailored to the mentee's individual needs and goals. C. Relying only on online resources for mentorship. D. Providing minimal feedback to encourage independent thinking. 19. What is the role of regulatory bodies in nutrition support clinician training? A. They solely provide certifications without influencing clinical practice. B. They ensure adherence to national standards for patient care. They focus only on theoretical training and disregard practical skills. D. They are not involved in training but merely oversee policy enforcement. 20. When assessing a clinician's understanding of nutrition support guidelines, what is the best approach? A. Offering unstructured feedback based on informal observation. Using a mix of practical assessments and written tests to evaluate skills. C. Focusing only on theoretical knowledge, excluding hands-on experiences. D. Allowing clinicians to evaluate themselves without external input. 21. Which of the following is a common barrier to effective communication in nutrition support education? A. Providing immediate feedback on clinical performance. B. Using complex terminology without ensuring understanding. C. Allowing learners to ask questions and provide feedback. D. Encouraging active participation through case studies. 22. What should a nutrition support clinician do when encountering a patient with limited understanding of their dietary needs? A. Assume the patient will not comprehend and avoid explanations. B. Use simple, clear language and provide educational resources. C. Focus only on clinical procedures without patient involvement. D. Overwhelm the patient with complex nutritional data. 23. How can the effectiveness of nutrition support training programs be measured? A. By counting the number of training hours completed. B. By assessing the long-term improvement in clinical outcomes. C. By determining how well trainees memorize guidelines. D. By evaluating participant satisfaction with the training materials. 24. In the adult learning theory, which of the following best describes the principle of self-directed learning? A. Learners should rely solely on instructors for knowledge acquisition. B. Learners take initiative and responsibility for their own learning process. C. Learners only need to be passive recipients of educational content. D. Learners should follow a predetermined instructor-led agenda. 25. What is an essential component of a mentoring relationship in nutrition support training? A. Providing minimal support to encourage independence. B. Offering opportunities for reflection and feedback. C. Avoiding discussions about performance to prevent discomfort. D. Maintaining a rigid, one-sided approach to guidance. 26. Which of the following is a critical part of a nutrition support clinician's training evaluation? Avoiding performance assessments to reduce anxiety. B. Providing periodic evaluations that focus on practical application. C. Relying solely on theoretical exams for assessment. D. Ignoring clinician feedback in favor of administrative decisions. 27. What is the best approach for integrating regulatory compliance into nutrition support curricula? A. Ignoring regulatory updates to focus on content consistency. B. Regularly updating training materials to reflect current regulations. C. Restricting discussions about compliance to administrative personnel only. D. Focusing only on academic knowledge, ignoring real-world applications.